Hello, good morning everyone. My name is Chaidi Pansakala and today we're going to discuss about chapter 6. So before we discuss about chapter 6 to the proper discussions, let's have our learning objectives that we need to attain before and after the discussion. First, describe the gene therapy in its various forms. Second is discuss the prevalence of gene therapy in daily life. Third is explore the opportunities that may be opened by gene therapy in the future. What is gene therapy? Human gene therapy seeks to modify or manipulate the expression of gene or to alter the biological properties of living cells for therapeutic use. It replaces a faulty gene or adds a new gene in an attempt to cure disease or improve your body ability disease to fight. So gene therapy holds promise for treating a wide range of disease like a different varieties of cancer, cystic fibrosis, heart disease, diabetes, hemophilia, and even AIDS. So, gene therapy is a technique that modifies a person's genes to treat and cure disease. Gene therapies can be worked by several mechanisms. First is to replacing a disease-causing gene with a healthy copy of a gene. Second is activating a disease-causing gene that is not functioning properly. Third is introducing a new or modified gene into the body to help treat a disease. There are two forms of gene therapy. First is the germline gene therapy. In germline gene therapy, DNA is inserted into a reproductive cell or eggs or sperm in a human body. Germline gene therapy will correct the genetic variants of the reproductive cells of an individual, and this would be passed down to the future generations. So one of the examples sa germline gene therapy kay kana ganing kana magpa-surrogate kanang duha ka mag-asawa niya, ang babae is impotent siya makabuo og bata. So ara pa diri nga ang DNA is inserted to the reproductive cells. So maybe ang egg cell or ang sperm cell kay gina-unite siya gamit ang pag-inject. So ang example ani niya is kanang surrogated gani kanang kung tayo gusto jud magkaanak ang mag-asawa. So mangita sila surrogated mother nga mo sila sa hospital, then ihatag lang sa lalaki ang iyang sperm cell, and then sperm cell nila o egg cell nila to si ipabuo sa babae sa surrogated mother. So kana siyang example, isa na siya sa mga example sa germline gene therapy. So dira kuan gyapon nagyapoy replication sa DNA sa husband ug sa wife sa katong surrogated mother. So dili magkalahi ang DNA sa mag-asawa o sa katong anak nila. Second is somatic gene therapy. Somatic gene therapy involves the placement of human gene into a living person's somatic cells that do not produce the eggs and sperms that in turn produce the next generation. So, somatic cell gene therapy would aim to cure a disease only in the patient, not in the patient's descendants. However, ang somatic cell gene therapy kay lahi siya sa germline therapy, opposite siya. Kay ang somatic cell gene therapy kay dili siya gina-produce sa egg ug sperm, pero directly siya sa cell. Directly siya sa cell. For example, kana ganing naay mga sakit nga mga bone marrow cancers, daginana. So, directly siya sa cell nga ginabutang, dili siya sa sperm cell. So, muna siya ang example sa somatic cell gene therapy. So, the similarity of both forms of gene is that therapeutic genes transferred into somatic and germline cells. So, however, there are differ into the following. First is somatic can introduce genes into bone marrow cells, blood cells, and skin cells, or etc. Whereas germline introduce genes into reproductive cells like eggs or sperms. Second is somatic cells gene will not be inherited into the next generations, whereas germline gene can be inherited and passed on to the later generations. Third, today, somatic cell gene therapy is often used to correct the genetic defects in somatic cells. However, germline cell therapy, for safety, ethical, or technical reason, it is not being attempted at the present. So, kung gina-attempt man siya, though na siya mga clinical test, clinical reason kanang ginabuhat siya, o mo to siya mga example ganina kung gihatag. That's it. So ana pa diri sa number 1, ana siya nga ang somatic cells daw is kanang ma-implant daw ang therapeutic cell sa mga bone marrow, sa skin, sa other cell. Whereas ang germline kay sa reproductive cells lang siya, directly siya sa mga egg, sa sperm cell or sa egg cell. So ana pa diri nga ang katuganing makita mo na to sa mga scientific mga studies o kanang mga documentaries gani nga namang ganito yung isa ka journalist or documentaries nga kuan daw na naday possible na daw nga ma-cure ang AIDS. So kanang for how many years nga gistudihan sa mga scientists, sa mga doctors mga curing method, mga therapeutic method, example po mga gene therapy method nga gina-advance nila ng for how many years, for 5 years to 6 years, na mga progress nga nang sa una kay think na to nga di imposible nga maayo ang isa ka sakit, pero karon kay kanang duol na siya sa posible